Welcome to the ACO Show, where we explore everything that's value-based care and ACOs, or accountable care organizations, and why value-based care can do more good for patients, practices, and society. I'm Sean Cavanaugh, and I'm here with my co-host, Dr. Josh Israel. Welcome, Josh.
Thanks, Sean.
This was a really interesting conversation. We had Brittney Anderson, who's a family physician from rural Alabama, who's done a fair amount of work and even has a podcast about helping physicians start their own practices. And it's sort of the step people take before they ever meet Aledade. And then we talked to Dan Bowles, who's doing similar work at Aledade, trying to internally develop a turnkey product to help physicians do the same thing.
Yeah, we're happy to speak to a fellow podcaster. You can check out her podcast, which is called Physicians Hanging a Shingle. And we heard from her about what it is that physicians are sometimes missing in their training. They learn all about how to practice medicine, but not always how to start a business, which I think for some people can be daunting. And that's why she wants to share the information. She's been very happy on her own. And it is also something that Aledade's been trying to tackle, as we hear from Dan Bowles.
We discuss with them the data, which is hanging your own shingle used to be the norm. That's what you did, particularly a lot of primary care practices. And increasingly, it's becoming the exception. So there's certain basic obstacles of having to rent an office and everything. But I think the environment has just gotten tougher too. And Dr. Anderson talks about that.
Yeah, certainly she shared what was tough, but really great to hear what she shared about the joys. So if you are a physician thinking about starting your own practice, hanging your own shingle, take a listen to her podcast or speak to Aledade and let us help you.
And let us know if you think we've jumped the shark by becoming podcasters who are interviewing another podcaster.
And here we go with the show. Welcome to the ACO Show. We are joined now by Dr. Brittney Anderson, who is a family practitioner in Demopolis in Western Alabama, and Dan Bowles, who leads Aledade's new turnkey effort. Welcome to you both.
Thank you. So happy to be here.
Likewise. Thank you.
So why don't we start with you, Dr. Anderson? I also forgot to mention that you have a podcast called Physicians Hanging a Shingle, and that's what we're here to talk about. What led you to get into the work specifically of helping other docs hang their own shingle?
Yeah, absolutely. So in July of 2022, I started my own private practice, solo private practice in rural Alabama, just me, my MA, an LPN, and a front desk registration. And we had this great idea of opening a practice, doing insurance-based practice, and practicing medicine in a way that felt really good to us. Gave all of us some autonomy, not just me as a physician, but my whole staff, and really allowed us to care for patients in a way that we knew would be us doing right by patients and to improve the overall health of where we are. And so we marketed the practice like crazy, did a lot of work on the front end, started the practice, and just really were practicing good medicine. We still are practicing good medicine, I believe. And word of mouth in our social media and everything else made the practice take off like gangbusters. And so over the last 3 years, I've had docs approach me asking questions just about our startup practice, how we did things, how we marketed it from the beginning, why everyone across the state is mentioning me and my practice, or at least know something about it. And so I spent a lot of time talking with docs about private practice, how to start their own practice, and got to a point, guys, where I realized I was kind of saying the same thing over and over again. And so thought that the podcast would be a really good way to say, you know what, go check out episode 3. There I talk about that. Certainly to answer any questions they had right there in front of me, but just a central space to be able to point people back to. And the podcast has become just that. It's still fairly new, but I love putting it out every week. It's just, a chance for me to pull back the curtain and show folks the steps that I took to successfully launch a private practice.
When Sean asks me anything, I usually just tell him to refer to a various podcast episode.
There you go. See, there you go, guys. I mean,
Dr. Anderson, where were you coming from? Were you coming out of residency or were you coming from employed practice?
So I was coming from employed practice. I did my residency training in Alabama. I actually went and worked a little bit for an FQHC, a federally qualified health center in rural Alabama as well. We are facing a lot of issues with hospital closures and other things that force that FQHC and hospital situation not to work out. So then I went into academic practice, which I love, and I still make teaching residents and medical students a part of my practice. But somewhere in the midst of being employed in academic practice, I got that pull that I think has always been there. The docs that I knew growing up family docs, our personal family doc, my best friend's dad, were all private practice, right? They're private practice. And when I was shadowing as a student in high school and in college, in my head, that's what a doctor was. It was somebody who did family medicine, who did primary care, someone who was well respected in their community and who really was a fixture in the community and who just provided good care. And so even being employed in practice, knew I wanted to do private practice and somewhere found that little bit of an opening, and I'll call it a little bit of opening, but burnout is probably the true word for it, and just got this idea that I could do it. And that is what we have done.
Dr. Anderson, I assume you're able to be helpful to other physicians because of your own lived experience with it. When you were thinking about making the move from an employed practice to your own practice, what were some of the barriers you were worried about and how have they gone since?
Yeah, so I think some of the things that I was concerned about are the things that most people are concerned about. And that is this age-old thought of no one taught me how to be an entrepreneur, right? They taught me how to practice medicine, taught me how to run codes, taught me how to suture, all these things, but no one taught me how to open a practice. And that's no ding on our medical schools or residency programs or things like that. The system is kind of set up for you to finish your training and go into employed practice. But that was one of the biggest concerns that I had going into it, was that I wasn't sure of what I was doing. I went looking for material and information that was out there. And yes, the American Academy of Family Physicians had some really good information, but I really leaned a lot on physicians who had already done it, physicians who had started their own private practice. I talked to ones who were successful in it. I talked to ones who were not successful in it, and just pulled together that information from them. So I think the biggest kind of barrier going into it was this thought of, I don't know what I'm doing. No one's taught me how to do this before. Am I sure I want to do this? And along those same lines, the thought of, can I be profitable in this? So I'm already in family medicine, a primary care specialty that just across the board isn't, highly reimbursed across our country. But there was also this thought of having that business sense. And could I pull the business part of it together to be able to be profitable? It is a huge responsibility, as y'all know, to not only worry about bringing income in for myself, but my nurse has a whole family that she has to, be responsible for putting food in their mouth. So it was this thought of, can I truly do this and do this in a way that everyone around me can benefit as well? And so those were two of the biggest barriers, but with lots of planning, lots of help from other docs who are already in their own private practices, and just lots of late nights and papers everywhere all over my house, we got through it, and it has been successful. And so I take it as my personal responsibility now to help other docs get through that process and just to demystify the process.
Dan, Josh introduced you as the head of something called Turnkey. Can you explain what that is?
Sure, but before I do that, let me just fangirl a little bit, or
Oh,
fanboy. Oh my goodness, Dr. Anderson, I'm just in awe.
thanks.
And so grateful that you're able to be here with us today and share a little bit about your story, and that you've got the podcast. I've been binging it
Yeah,
since
thanks.
I learned about it. Yeah, Sean, Turnkey is really trying to hit on all of the themes that Dr. Anderson just said. And it feels like something that we've been trying to, work up to at Aledade over the course of the last 10 or 11 years that we've been doing this. First, a couple of data points. In 2012, depending on which stat you look at, 55 to 60% of practices were owned by physicians in America. In 2024, that number was about 33%. And, you can chalk that up to challenges with reimbursement. You can chalk that up to, the mystification process that Dr. Anderson alluded to, or the fact that, as she said, the system's just really not set up to help physicians start private practices. We've been looking at this for a long time, and part of the challenge with the reimbursement dynamic is traditional fee-for-service models makes it really hard to create a sustainable private practice. 10 or 11 years into value-based care, we now feel like we know enough and we've seen enough and we've done enough to prove that value-based care revenue can meaningfully change the economic profile of independent practice. And Turnkey is really about helping physicians embrace clinical and operational autonomy and go back out on their own with a little bit more support. So we plan to offer physicians some help with payer engagement and contracting, some help with kind of back end operations management, EHR, revenue cycle, practice management systems, some help with marketing, but also a lot of playbooks related to, kind of how you do day-to-day work in a practice. And we've got a handful of former very strong practice managers that have helped us to develop it. We've also developed it in conjunction with several of the physician associations, both at the national and the local level. And, we are hopeful that this is just one way we can help level the playing field so that physicians have a multitude of options, no matter where they are in their career. We really are trying to make this, as pro-physician as possible.
Dr. Anderson, one of the reasons that independent physicians are such a desired group for Aledade to work with is that when you keep your patients healthy, when you earn shared savings, you keep it and you're directly incentivized. It doesn't have to go through layers of administration. Do you find for yourself that being in a value-based care organization like Aledade has helped you be independent?
Absolutely. Where I did my residency training, we used Aledade then. It was part of our residency training. But I'll be honest with you guys that, we got these huddle sheets and, our attending said that we had to go through them. But my classmates and I, sometimes we did them, sometimes we didn't. I don't know that we truly fully understood what we were doing and understood how beneficial it could be to us then. So then I go into the employed academic practice that I mentioned. And yes, it's starting to make a little more sense to me now. I'm able to effectively use that huddle sheet and I understand more of the benefit. But as soon as I decided that I was going to start my own private practice, I'll tell you guys this, I was sitting in the parking lot during lunch of my employed practice, still working. I'd given my notice, but was already in the stages of building this new practice in my head. And I was on a phone call with Aledade talking about this is the date we're going to open. Let's go ahead and get me plugged in. I'm ready to start. Because as I started to build a practice, just as Dan was saying, I started to realize how beneficial it was going to be, how beneficial it would be to me from a population management standpoint for my patients. And when I said earlier how much our patients love our clinic and what great rapport we have with them, so much of it is because of that information that we get from Aledade. That's something that as a small private practice, I don't know that I'd be able to do on my own. When I can go into, let's say, Mrs. Jones' room and I'm saying to Mrs. Jones, when was the last time you had your eye exam done? And she's saying, oh, I don't know. But I can look back at that sheet and say, oh, you went and saw Dr. Smith and got your eye exam done on this day. And this is the day you had your mammogram and you haven't picked up your metformin from the pharmacy. And that takes that experience, that patient visit with Mrs. Jones to an entirely different level because I'm continuing to build a relationship with her and she is getting more personalized care. And so I understand that the benefit and the beauty of, being a part of a great ACO and Aledade has it's been gangbusters for us. It really has helped us, even outside of the financial incentive part, it really has helped us to practice better medicine for our patients to feel better about what we're doing. And the added bonus there is as an independent practice, it allows us to put some extra money into our bank and do things that we need to do, whether that's giving my staff bonuses. They understand that there are measures that are there that have to be hit. So if it's giving them bonuses, if it's buying a generator, if it's buying a new vaccine fridge, these are things that we need and things that are important to us to have. And so being able to bring in that extra revenue from the incentives from it is everything for us.
Dan, Dr. Anderson described some very personal reasons why being independent was important to her. You're talking to a lot of docs who we might work with and some who we already are working with. What are their motivations for being independent?
The first word that comes to mind is community. They really want to take care of a group of people. Some of them have come home to the community they were raised in, or they've taken over the practice that a family member or a friend previously held or led. So that sense of community is really important to them and taking care of people that are close to them. The second thing I think is kind of a play on the first, but somewhat different. There's certainly an entrepreneurial spirit to it. But it's not entrepreneurship for entrepreneurship's sake. It's entrepreneurship because they feel like they have something to add. They feel like they have something that is worth bringing into the community and not getting lost in the layers of administrivia that Dr. Israel alluded to earlier. And then I think the last word that comes to mind is autonomy. Every physician that I've ever spoken to knows what their patients need. And they know that not because they're smarter than anybody else or, they have some kind of high-minded sense of themselves. They know it because they know their patients. and they've, kind of spent the time at the bedside with them and they know exactly what's going on with them. So the feeling of autonomy, I think, is the biggest piece of those three. We've had plenty of conversations with physicians who are independent. I've had plenty of conversations with physicians who are seeking independence, and that ability to, really go in and care for a community and deliver care in a way that they know is best is at the root of it.
And I'll say, Dan, you are speaking my language there. And that is what so many docs say to me too when I'm talking to them about why do you want to start your own practice? And so they'll come and ask me questions about the startup process. But I love getting to that mindset part of it. And those three things you mentioned, you hit all of them dead on the head, with autonomy certainly being a big part of it, wanting to just break through the barriers that are there to doing what you know is right for patients. The community part is huge. I'm family medicine again. I've probably said that 3 times now, but I'm family doc and just love the sense of community that I have here because I'm a single, not young anymore, female. I coach a softball team here in town. I have no kids, right? Everyone wants to know who's my kid on the softball team. None of them. I'm coaching an 8U softball team. None of them are mine. I'm a Girl Scout troop leader. None of them are mine. We're just out here selling cookies, living our best lives. But that sense of community is so important. And that is what I'm at this point where I hope the pendulum is swinging back, right? And I think that when we're able to build that good rapport and those good relationships with patients, that is how we're going to overall improve the health of our country.
So why are doctors typically starting their career and maybe even spending their entire career increasingly in an employed status if there's so many nice benefits that you've described to being independent?
Yeah, I think a big part of it is just not understanding what's out there, right? So maybe not getting that exposure to independent practice docs in their residency training. So if you're training in a residency program that's in a big area and you're not spending that time with docs in independent practices, you don't realize, hey, there's a whole other group of people out here who feel good about what they're doing every day, who are able to make decisions on the fly that they feel good about. So I think a part of it is just not realizing what's out there. And then two is just that shift that people before me did this in last year's class, this is what they went into. So it's kind of just staying the course of what has been done in the most recent year. So I think continued exposure to independent practice docs is really important. And then too, like I mentioned earlier, I think it's just that fear of, can I truly do this? And do I know how to do this? And so things like, the Physicians Hanging a Shingle podcast and the turnkey program that Dan has mentioned here, that's how we start this, right? That's how we start saying there are options that are out there. It's okay if you didn't know how to do these things. I mean, the first time we intubated a patient, we didn't know how to do it. The first time we ran a code, we didn't know how to do it. But we had someone there walking us through the steps of it. And now we do those things and we don't think twice about not being able to do it. And so it's just a matter of having a guide there, a guide that you can trust and a guide that is proven. And so I think, both of these models that we're talking about, whether it's turnkey or having podcasts, those kinds of things are ways to see, hey, there are people out there doing this and I can do it too.
I love it, Dr. Anderson. You are applying the time-honored medical school teaching of see one, do one, teach one.
There you go. That's it. That is it. I'm gonna have to borrow that. That was good, Josh.
And I think to further the point, every time I've been out talking to physicians, whether it's at an association meeting or over dinner or in other settings, what we hear is, I just didn't feel like I had any other options. And I don't want to put down employment. For some physicians, that's absolutely the right path. And there's nothing wrong with that at all. What's wrong is the fact that it has become the only choice. And I think what Dr. Anderson's doing and what we hope to do with Turnkey is really start the conversation about creating better options and leveling the playing field so that physicians can make the best choice for themselves no matter where they are in their career, in their life, and, hopefully demystify the process along the way because it is hard. One of my favorite lines on your podcast, Dr. Anderson, is, we're physicians. We can do hard things. Right? I'm not a physician. I didn't take organic chemistry, but there's probably a reason I'm not.
You didn't miss much, trust me.
Yeah. But it shouldn't be as hard as organic chemistry, how to get all the pieces together.
That's right. Absolutely.
I just want to provide a little context. So we're talking about the motivations of individual practitioners. The policy environment is that increasingly markets are consolidated where more and more physicians are becoming employees of health systems. There's a substantial literature now about how that leads to higher costs. The impact on quality is a little less clear in the literature, though there are fears that it will lead to lower quality because that's typically what happens in consolidated markets in other industries. So that's general health ecosystem. Specific to value-based care, the track record is also pretty clear that physician-driven ACOs, particularly in the Medicare Shared Savings Program, but in other contexts as well, are significantly outperforming those that are centered around a hospital. And a lot of that has to do with the incentives apart from value-based care. But I just want to put this into context because we focused a lot about the motivations of the physicians, which I think is important. But you've also mentioned the impact on patients. And I think it works at both the individual level, but a social level as well.
Well, and I think maybe further to that point, there's a lot of angst right now around access and around shortage of primary care. And we certainly do not have enough primary care physicians in America. That much is clear. But there's ways that the relationship with the patient is strengthened because you do have that kind of trusted primary care home. So I think from a cost standpoint, absolutely, it's better to have a bunch of physician-led organizations in the mix. From a quality standpoint, I agree that the literature's mixed, but I think it's pretty clear that independent practices tend to help.
I did have a question for you, Dr. Anderson. Is Demopolis, if I'm pronouncing it correctly?
Yes. City of the people.
City of the people. Did you grow up there or?
I did not. I grew up in Prattville, which is about an hour, 20 minutes away from here in Demopolis.
Okay.
So it is very much like home. Just the way Alabama is. Prattville was a very small town growing up. It now has a Target and a Belk, so it is no longer a small town. And so I tell people that Demopolis reminds me very much of Prattville growing up. We've got a Walmart, we've got a Jack's, and a Taco Bell.
Well, Dr. Brittney Anderson, family practitioner in Demopolis, Alabama, and host of the Physicians Hanging a Shingle podcast, and Dan Bowles of Aledade, who leads the new turnkey effort. We really appreciate the conversation today.
Thanks, guys. It's been my pleasure. Thank you so much for having me. It's great. We're looking at each other on screen. I feel like I know y'all already because I listen to your voices on your podcast. So it's so great to get to see you guys. Thank you for your time. I appreciate it. And Dane, it's so nice to chat with you. I love what you guys are doing with Turnkey. Aledade has been a game changer for my practice, and I know that Turnkey will be a game changer for other docs as they start their practices as well. So thank you all.
Thank you.
Yeah, thank you.